Hey, it's Dr. Mika Riley from MoveMend Rehab and Performance. You might be watching because you just discovered that you tore your ACL. I imagine you're going through a lot right now, but at this moment, getting more information is the best thing you can do for yourself to make sure you're in the right hands and to make sure you explore all the options available to you. A question we often get is whether you need to have ACL surgery or not, and if surgery is worth going through. In this video, we will get into the details on all the options available to you, including the latest research regarding non-surgical management of ACL tears. We want you to know there's more than one choice out there and that you should consider all options before making a decision. After injuring your ACL, there are two options: surgery or no surgery. Typically, surgical treatment is predicted to have a favorable outcome in people who are less than 30 years old, very physically active, and in those with additional tissue injury inside the knee like the MCL or meniscus, or both. The ACL is a primary stabilizer of the knee. Most often, it is people in their teens to early 30s who tear their ACL, particularly when performing vigorous, higher-level change of direction sports like soccer, football, basketball, or skiing. Once the ACL is completely ruptured, instability occurs and causes reliance on other structures like the meniscus to act as stabilizers in the knee and can lead to further consequences, especially if someone decides to continue playing while fully ruptured. One main reason for opting into surgery is that there is a failure of blood clotting during initial healing, which causes a lack of scaffolding between the two torn ends of the ACL. Second, a layer of tissue can form over the torn areas of the ACL, which can reduce healing potential. Therefore, reconstruction is the most common surgical option due to poor healing. Athletes in the adolescent age group who have not fully developed and are participating in vigorous sports activities are at increased risk of further injury and would not be an appropriate candidate for the non-surgical management. Surgery for this age group can improve stability in the knee and improve the function in the knee, ultimately allowing continued participation in those vigorous higher-level sports. Now, as you may already know, there's always a risk with anything you do. There's a 30% chance that you can re-injure your reconstructed ACL within the first 2 years. Know that a reconstruction won't guarantee you a good-looking knee in 10 years, and it will look different and may function differently. But it is worth noting that not everything is guaranteed, particularly if you go the surgery route. This is where it is imperative you select an experienced PT who has up-to-date knowledge on ACL rehab to ensure a safe return to sport to reduce your risk. Another option for you is electing not to have surgery and treating your ACL non-operatively. Although the number of ACL reconstructions has been increasing year over year, there is plenty of research showing that not only can people have great recoveries without ACL surgery, there's new evidence showing that a ruptured ACL can heal. Now, it is quite difficult to speculate which athletes will have healing potential, but good candidates usually include people over 40 years old who don't participate in higher level pivoting activity, to just name a few of the criteria. Recent research has shown that people who opt out of surgery versus those that chose to have surgery did not have different results or outcomes at 2 years and 5 years. Even though we know that people who decide to manage their ACL surgeries conservatively have good outcomes, knowing exactly who will have a good outcome is tricky. In general, if you are over 30 and don't play higher level cutting or pivoting sports and only tore the ACL, I would recommend trying conservative management before immediately opting for surgery, because this route is much quicker and less costly. Do know there is no wasted time with this process. If you decide to opt out of surgery and go through 12 to 16 weeks of solid rehab, but then decide you want surgery after that, you still are going to go into surgery very strong with a calm knee and will have a better outcome after surgery. What we do know is that no athlete should be rushing into surgery right away. It is about what is best for you after considering all the options and how the knee is functioning after a structured bout of appropriate physical therapy. Should you and your healthcare team decide surgery is an option for you, you should strongly consider a structured PT program to prepare you for surgery to improve your outcome. Should you decide surgery is not the route you want to take, you should still strongly consider structured rehab. There is no wasted time when you are calming the knee down and getting stronger than you have ever been before rushing to make a decision. If you want more information, click on the link below to watch one of our videos on how to find the right PT for your ACL journey.